Hello friends, I'm going to teach you today the core principle about how to overcome fears and anxiety problems. I had blood phobia, okay? So when I was 10 years old, I went to a lab and then to draw blood from me. They started drawing the blood, I saw the blood in the syringe and I fainted. So that was the way I was as a child. Then when I was in high school, I had a course on introduction course on psychology. And I found that psychology was extremely interesting. And I thought, okay, what about I go to medical school and I can learn psychiatry? And then that should be very interesting. I can learn more about mental health problems. And then I thought, okay, how are we going to do it? I had blood phobia. If you go to medical school, I may not feel so well, right? But I decided, oh, I'll find a way. I'll go and I'll find a way to get used to the blood. So I did get accepted to attend medical school, and then I remember starting the medical course, and I was in anatomy class, I'll see the bodies, the body parts, and I'll feel lightheaded, right? So I'll just look a little bit, and a little bit more, so start slowly getting used. And one day, a professor came and showed us a video of a surgery, and it was too much for me. I was almost going to faint, and then the professor came and said, put your head down, Alex, and then I didn't faint, but then I went back to the anatomy classes, then looked more and more, and then I got used to it, and then I went throughout medical school, I start helping surgeries, stitching, and I really love it. Actually, I love operation rooms because they're very clean, organized, and I like that a lot, right? And I like helping the stitching. So I could have become a surgeon. So I overcome completely my fear of blood. Let me tell another story. Is the story about how Dr. David Burns, who's also a psychiatrist, how he overcame his fear of blood. So Dr. David Burns, he's very famous because he wrote several amazing books. His first book is called Feeling Good, was published in 1980. And studies later indicated that just by reading his book, almost 70% of the people overcame the depression, just reading his book. Isn't that amazing, right? Later, he published the book When Panic Attacks, and more recently, in 2020, he released the book Feeling Great. Feeling Great is the book now I prescribe the most for older teenagers and adults who I see in my office who are suffering from anxiety or depression. Okay, so his books are really amazing. Okay, so like I was saying, Dr. Burns also had blood phobia when he was a child. And Dr. Burns tells in his book When Panic Attacks that one day he was helping in the emergency room when he was in medical school. And a man was brought into the emergency room because this man apparently was making a bomb at his home, and the bomb exploded in his own hands. And then he was all bloody, really looked terrible, but looked in really bad shape. And then all the doctors worked on him, and nurses, and they could revive him. He was still alive. And then the nurse call him and say, David, come here, I need your help. Please hold this toothbrush. And then Dr. Burns, he's still didn't finish medical school yet, was David, then said, oh, why you want me to brush this man's teeth? And the nurse said, no, David, it's not to brush this man's teeth. So can you see the powder from the explosive in this man's raw flesh, all the powder there? Say, yes, I can see it. Okay, the explosive is toxic. So you have to go there and remove all that powder, because otherwise he could die because of intoxication from the powder. And then David said, I cannot do it. And then she said, David, you have to do it. Then he went there, started removing the powder, and he was consumed with panic because he was seeing all this bloody body of that gentleman. And it was really overwhelming, but he continued doing it. And then about 10 minutes later, the anxiety was suddenly gone. So that's how Dr. Burns overcame his fear of blood. And he tells his body later he could help in surgeries and he had not a problem to see the blood. So the way Dr. Burns overcame his fear of blood is called flooding. The way I did it is called progressive desensitization. So these are the two main ways we teach families how to overcome fears and anxiety problems. Okay, so let me explain a little bit more what's the difference between the progressive desensitization and flooding. So the progressive desensitization usually is like a stepwise exposure for the therapy. For example, somebody has fear of public speaking. Then what you can do, you first get a sheet of paper and list down there several situations where you feel anxious. Then you rate from 0 to 10 how anxious you feel on each situation. So then later you transfer these situations into an exposure letter. So on the bottom of the letter, you list the situations that you feel only a little bit anxious, and on the top of the letter, the situations when you feel most anxious. To do the progressive sensitization, then you start with the situations on the bottom that are easier. A child, for example, could go to a restaurant, and when a day the restaurant is empty with their parents, and then the child help order the food when there is almost nobody there. So that would be, let's say, an easy task. Other task would be the child has to order in a busy restaurant with crowded in front of people. Right? So that's again, the idea is start with the easiest task and go slowly up to the hardest task. What happens is when you do like this, you give time to your body to get used to the easy situation, and then you conquer that fear. And so when you go to the next step, let's say what used to be a 4 out of 10, in difficulty 4 or 5, is no longer 4 or 5, it's already a 2, because you already conquered the smaller steps, you're already close to it. So each time you conquer one step, the highest step actually is like come down, it becomes easier, right? So that's the progressive sensitization. Usually a way to conquer that using what we just described to you is called exposure letter. The flooding is different because you go and just say, you go and immerse yourself in what makes you super anxious. So for example, let's say somebody has a fear of elevators. The flooding will be, okay, so you just go enter the elevator, stay there until the fear is gone. So in the beginning, you'll be super panicked, there will be maybe your heart's racing, and you feel terrible, yes, but if you continue there, and of course, an elevator that's working properly is not a dangerous elevator, it's like, there's people using, it's a safe environment, right? You keep staying there, eventually the fear, most times the fear eventually will go away. So that's called flooding, right? So you flood yourself what the situation make you anxious, like Dr. Burns did when he was just stay there helping with in the emergency room where there's blood all the time. So you didn't go through the steps, right? You go just fully immerse yourself in that. So that way is faster, but can raise your anxiety at extremely high levels. Again, you usually avoid that in children because the experience itself can be traumatic, right? So these are the main difference between the two. The progressive sensitization is lower, it's a stepwise progression, and the flooding is quicker and immerse yourself to the thing you're afraid of. I hope this information will be helpful, but there are more to learn. So we usually recommend that families do attend appointment with the family doctors, that's for sure, and the family doctor can decide if this child or adult should see a mental health care counselor or should receive medication. At times medications are used, or if you should use the books we recommend. There are several amazing books that we recommend at times for families to learn more about the treatment of anxiety and fears. The one I recommend the most today for older teenagers and parents that I see in my office is the book Feeling Great by Dr. David Barnes. When I see young children with their parents and the children suffer from anxiety or fears, I usually recommend that parents read with them the book called What to Do When You Worry Too Much. If it's an older child or young teenager, I recommend that parents read with children the book Outsmarting Worry. If that is an older teenager, then I recommend the parents and the teenager read the other books together, like the book Feeling Great that I mentioned, or the book When Panic Attacks by Dr. David Barnes. It's very important that parents always be involved. The treatment is always more effective when the parents are involved in the treatment of their children. I hope you found this information to be helpful. There's a lot more to learn. I create a playlist that I included above. Just click on the link above and you can continue learning more. I also include the name of all these books in the video description. Please review also in the video description the terms of use of this video. This video is not a medical advice. Thank you for watching.